One of the big challenges for a skilled nursing facility is the amount of patients that are being discharged from hospitals and then readmission back to the hospital. The second challenge is with the regulatory changes. Facilities have to deal with not only the state, but the federal, and then also the rules that are applied to the pharmacy. And a lot of these rules are very vague and they can be confusing for the nurses to be able to decipher. Facilities have to deal with waste on a daily basis. Nursing facilities waste between thousands and thousands of dollars of medication each year. When a medication is discontinued or whatnot, the unused portion of it is just wasted. Swisslog Healthcare, our in-site, in-facility packaging dispensing system, provides the facility with access to medication. The medications are packaged and dispensed on demand so that there's literally no waste. So the facility now is only getting an on-demand, as needed, when the patient needs the medication. You eliminate the process of the nurse having to go write up the medication when it's discontinued or having to go into destruction. In addition, we also limit the waste with controlled substance as well, and the accountability controlled substance. The long-term care pharmacies today are faced with many challenges. One of them is having to deliver medication at a much lower cost to their facilities. In addition to that, have to be able to provide more frequent deliveries of medication. With the traditional punch card the pharmacies use, has over the years have really left a system within the pharmacy and the facility that's very cumbersome. It's very tough for the pharmacy and the nursing facilities to have to deal with those punch cards. And it's also a very inefficient, very error-prone system. With the traditional punch card, when an order gets discontinued, the facilities will have to go through a process of having to write up that medication and go through an extensive process of having to destroy that medication. For facilities that are forward-thinking, they are starting to use our in-facility packaging and dispensing system that enables the facility to package the medication only as needed. So essentially eliminating the waste, also allowing the facility to be able to save time, not having to prep for the medication, and then be able to reallocate their time into other patient care. On the pharmacy side, instead of filling your traditional punch card, the pharmacy now is only filling a canister that gets delivered to the facility, and then as the patients need their medication, then the machine will package and dispense patient-specific medication for nurses to use. The pharmacy has a potential of saving $12,000 per year per machine that is put into a nursing facility. The system also creates a conduit between the pharmacy and the facility to be able to deliver higher quality care to meet the demands of today. It also gives the pharmacy a potential of being able to extend their pharmacy services contract facility, and the facilities being able to have that same pharmacy for extended time without having to make changes. The level of patient care, the high acuity patient demands more on a nurse, and yet they're having to deal with less, and then also the impact of high rate of staff turnover as well. The Swisslog healthcare system helps create the efficiencies with the facility. The nurse, helping the nurse with the med management process of using our on-demand facility where the nurse has access to medications to meet the demands of high acuity patients that are admitted to the facility. The machine also has availability of PRN medications in addition to the routine medications.